Bismillahirrahmanirrahim. My article for this week is titled as Pulp Sensibility Response Following Complete and Partial Bulbotomy in Mature Permanent Molars with Carious Bulbal Exposure and Symptomatic Irreversible Bulbitis. It is an analysis of pooled data from 3 randomized clinical trials that is done by Sangwan and others, and it is published in the IEJ in 2025. So the study aimed to evaluate and compare the bulb sensibility response to the electrical bulb testing and cold test in mature permanent molars treated with either complete bulbotomy or partial bulbotomy. They included 220 mandibular molars with deep caries and clinical diagnosis of symptomatic irreversible bulbitis, where the treatment was done by postgrad students using the Pro-Root MTA as a capping material and a final restoration of composite resin. For the sensibility test, the electrical bulb test and the cold test were done over 12 months, and the clinical and radiographic success criteria were no pain, tenderness or swelling, and a PAI score less than 2. They reported that the overall success rate is 95%, and among teeth with successful outcome, 81% of teeth treated with complete bulbotomy and 95% with partial bulbotomy group showed a positive response to the electrical bulb test, with the difference being statistically significant. For the cold test, 84% of the complete bulbotomy group and 90% of the partial bulbotomy cases responded positively. And when considering a positive response to either the EBT or the cold test, the rate increased to 93% in the complete bulbotomy group and 97% in the partial bulbotomy group. Also, factors such as the number of the restored surfaces, the preoperative pain intensity, and the presence of the hard tissue barrier did not significantly influence the bulb sensibility response in either group.